School difficulties in children. School adjustment is synonymous to success in one's life and mental health. Selecting a school is one problem. After you select a school, the child has to get adjusted to the school and he has to have a good performance. Now, the parents burden the child with expectations, wanting the child to achieve the highest educational degree and with first position everywhere. Now, all of these expectations, if not met, they create frustration, anxiety, and depression. There is, and school difficulties are very prevalent in children. About one third of children find it very difficult, have school difficulties. Now, school difficulties, you will get to how do you get to know that the school difficulties is when you start receiving various complaints about the child. Complaints like, poor comprehension, poor concentration, poor memory, inability to reproduce learned material, does not get good marks in spite of all the hard work, not interested in studies, hyperactivity, does not want to write, does not copy assignment from the board, watches TV for many hours, afraid of teachers, headache, abdominal pain, excessive anger, aggressiveness, lying, stealing, bunking school, no friends, loneliness, poor self esteem, spends a lot of time playing, and school refusal. If you get complaints like these, you will sense that there is a school difficulty in the child. Now, causes of school difficulties. Academic success is fundamentally important for social development and post school opportunities in life. The syllabus that the child has for a particular age group, the child is supposed to cope up with that syllabus, supposed to, cope with that syllabus, and he's supposed to understand that syllabus because that syllabus is meant for the child of that age group. And if he's not able to do that for many reasons, then he is having school difficulty. There is a need to carefully scrutinize the cause that may lead to school difficulty. Now, there are many causes that will lead to school difficulty. First of all, it can be disability of any kind. The physical handicaps where the child has poor vision or speech and hearing impairment, poor motor coordination, weak limb movement, and may have problems in performing well in the school. Now, these problems, because of some physical disability, he might also have self esteem, low self esteem, difficulty in making friends, insecurity, which leads to poor concentration and decline in schoolwork, apart from difficulties at the socio emotional level. This is physical handicaps. This is the problem with physical handicaps. Now, intellectual ability or lower IQ that are there in the children. Now, lower IQ is the cause for poor comprehension, memory, and the child loses interest in studies and he cannot do well in spite of all the hard work. Nagging and punishment will only do more harm to the child than benefit. Now, specific learning disability, any learning disability, specific learning disability, SLD, also known as dyslexia, is a dysfunction in one or more of the learning process like attention, perception, processing of the information, memory, etc. Now, SLD affects specific area of performance such as reading, writing, spelling, and arithmetic, whereas areas the child may function optimally. Now, to develop or to increase his intelligence, strategies can be used for the deficit areas. Chronic illness, physical chronic illness. Now, the point number two, which cause school difficulties, can be chronic illness. The physical chronic illness like epilepsy, diabetes, thalassemia, cancer, etc., because of which this child might have to repeatedly go to hospital and miss a lot of school, thus does not cope up with the academics. Now he might have poor self esteem. So to cope up with this, he has to cope up with the physical illness. To cope up and to get over the school difficulties, he has to basically cope up with his physical illness, plus he has to take help from the other students. Now, chronic illness can be physical or psychiatric. Psychiatric, where they might, psychiatric illness like autism, schizophrenia, depression, anxiety, ADHD. Addition, attention deficiency hyperactivity disorder. Now, these disorders are reversible with treatment. Now, psychological factors. There are many psychological factors like environment, the family, the expectations environment, which includes family can have a lot of expectations on the child, or the family might not have a environment where the child can study, for example, which has alcoholism, and then lack of discipline, and then poor parenting, and then financial constraint, and then spending a lot of time in TV, and then not more parents not being motivating for the child. This can be not motivating to the child, and from the friends in school he might have poor performance because because of the influence of peers and friends, and they might have negative influence on the child. And the school environment also might not be so conductive to academic pursuits, and then lack of motivation. The child may be lacking motivation to study and perform. A few children have been found to show complete disinterest in studies as they do not have ambition and goals to achieve. Now, one has to have ambition and goals to achieve, which will motivate that person to study further and do a little hard work. If it doesn't have this lack of motivation, then obviously it will affect in carelessness. Then faulty learning styles is faulty learning styles. The child might have faulty approach to learning, which he superficially glances through the contents, does rote learning without understanding the subject. The child with faulty learning strategies may spend too much time on studies or too little, not leading to satisfactory output in exams. The personality. Some studies have been carried out to see correlation between personality and academic performance. Introverted boys perform better, whereas extroverted girls perform better. Anxiety and expectations. The expectations of the family. It is well known fact that excessive anxiety disrupts performance. The phobia of the exam or inability to read and recall despite preparing well. Anxiety interferes in performance, leading to results below expectations. Poor attention span, ADHD. And then conduct problems. Children with conduct problems demonstrate signs of aggression toward bullying, abusing, and all these lying, stealing, violation of rules. You know, this the such behaviors may try to gain attention of others, children, and teachers. They may show poor academic performance as most of the school time is spent in gang work. Now, substance abuse, use of substances like tobacco, pan masala, illicit drugs, inhalants, ink removers, alcohol is on the rise in school children. With such habits, the child's studies may be neglected and hampered. Long-term use of these substances can cause cognitive impairment, poor school performance, school with social withdrawal. Now, stressful life events, which like transfer of the father, death of grandparents, parents, illness of family members, conflict, separation of parents, all these, the child's mental and physical energy might all get absorbed in coping up with the stressful event, and thus poor academic performance. Now, assessment of school difficulties. How to assess that the person is having school difficulties? Now, most of the times, actually parents fail to understand that the child is first of all going through a school difficulties, and then if they understand that the child is going through a school difficulties, faulty management of the problem is done. You know, and and if the problem is not assessed, then the academic performance is constantly deteriorating. Now, instead of the nagging in deteriorating, now the parents might nag or give punishment which will aggravate the problem. Now, the causes of the problem and the plan for its management has to be done for the sake of the child, who has school difficulties. Now, how do you actually assess that the child has problem? Now, basically we have to have an informal talk. How do you assess that the child has a problem? Point number, child has a problem by informal talk. First of all, you have to have an informal talk with the child, asking him what happened in the school, who are his friends, what are the activities that took place in the school, what is school like, and then what he likes in the school, what he dislikes in the school, and how he behaves towards his teachers and and he studies, and how he studies, how his attitude towards teachers and studies. And then physical fitness is also very important. Should be screened periodically. Physical fitness should be screened periodically. Some kind of disorder will interfere in the in the academics of the child, attendance, learning and performance in the school. Now also intelligence should be assessed. The IQ of the children should be assessed. Now people with children with low IQ, the children some children have low IQ, and their parents have to be told to not pressurize the child because he has low IQ. And then teaching techniques has to be taught, where simplifying the content, the content can be simplified, and breaking it into small parts and memorizing through cognitive maps can help children with lower IQ. Now you have to see if the child has specific learning disability, attention span, conduct disorders, studying habits, motivation, stress in the family, anxiety, expectations of the child of his parents. It's some kind of stress. You have to now realize if there is some kind of stress that the child has. And psychological tests can be used to know the degree of problem, to quantify the degree, to quantify or to know the degree of problem the child has. Now the personality of child is also very important. For example, introverted boys perform better and extroverted girls perform better in school. Now test anxiety is very common in children. And then family problems also are a very important thing, like for example financial problem, conflicts, or some kind of problems going on in family like alcoholism and all of that, which give puts the child into stressful information. Now the stress and the mental pressure that the child gets, the all the energy will be used to cope up with that, thus to cope up with the stressful events, thus not allowing the child to perform, to use his energy efficiently to study or to do well in school. Now, we have to know the study schedules. How many hours is this child studying? Is he daydreaming during studying? Or how does he manage to study? How does he manage his time while studying? It is also important to know who the teacher is, what are the techniques of discipline that are used. Also the rapport, if there's a private teacher, the rapport between the teacher and the child also affects. And if the rapport is not good, the child might develop hatred towards studies and his performance further deteriorates. Behavior in classroom and his day-to-day activities, his social relationship with his friends also needs to be needs to be assessed. And then psychiatric illness or domestic abuse or any illness like that, these could be due to complex interactions of child's own potential, personality and the environment. And then early recognition of the problem is very important. The earlier you recognize that the child is going through a specific problem, you can deal with it in a better way, and you can effectively, therapy can be effective on the child, and can effective theory can be effective on the child. The earlier you get to know a certain problem, the therapy can be effective on the child that well. Now, assessment of the child can be carried out through observation and administration of psychological tests and other measures. The information recorded with respect to, now you have to record information of the child, which can help in carrying out the assessment of the child. Information that you need To carry out the assessment can be the case history, which includes the developmental history, the intention, the IQ, the attention memory, the IQ, the specific learning disability if he has any, the studying skills, the psychopathology, the family expectations and environment, identification of any physical disability. Now, impact of school difficulties on the child and family. Now, you know, studying and skills. Now, the child, impact of school difficulties on children and family. If the child does not behave well or the child is not studying well, he might show some kind of behavior at home. For example, this show some kind of behavior at home. For example, he might be quiet in school, but he might be very aggressive at home. And basically there is low self-esteem in the child, and he's very confused, and he is not very happy, and he's not very cheerful, and his state of mind is not very nice. He has not got many friends. So all these school difficulties, have a great impact on the child. So the therapy helps in child to get involved in school better, and to better his performance and change his behavior into a positive direction. Now, the school difficulties can be because of many reasons. For example, when you take family, the expectations of the family, and expectations of families can sometimes also result in attempted suicides by the children. Also, if it can have a negative impact on the siblings. Now, the counselor can provide help to children and their families who have children with school difficulties. Suggestions to overcome school difficulties for parents. Now, for parents, the parents have to accept that their child to accept the child's IQ, the ability, child's level of ability. Parents should not nag and beat the child. Encourage with rewards. They have to be firm and consistent in disciplining the child, and they have to create an environment which is friendly for him, and which makes it easy for him to learn new things, and provide guidance and support to the child. Respect your child's opinion or suggestions on improvement. Involve him in planning his activities and making timetable. Ask him to write diary to improve self-expression. Help him in learning through games. Discuss the and reduce the effect of stressful events in the life. Have a healthy and happy family environment. And suggestions for the child to overcome school difficulties is that he should learn correct studying skills, and then he should learn strategies to improve specific learning disability, and then he should learn how to increase his concentration by basically doing some activities, or magazine by grain sorting activity and all of that. And he should have behavior therapy to modify conduct problems. He should learn to reduce anxiety with exercises, distraction, changing negative thoughts to positive. And then where he should learn how to decrease the exam anxiety. And then he should have high self esteem, how he can have high self esteem. And then he should develop social skills and self confidence. Family counseling and training and coping strategies for the child are useful in these cases. If the child has depression or any other physical problem, they should be referred to the concerned physician and psychiatrist. Now, how management of school difficulties. How school difficulties. Suggestions for parents we have understood. Suggestion for children we have understood. Now, management of school difficulties. Making timetable is very important, which will keep the child constructively occupied in that time. And short periods with breaks, setting reasonable targets, rewarding the child, ignoring undesirable behavior, helping the child make friends, being firm and consistent in disciplining, learning through play, improving memory through improving memory, making a to-do list that has to be completed.